as possible.
The honourable member for Leeds, Grenville, Thousand Islands and Rideau Lakes.
Yesterday, the health minister told committee that the government had a plan for every possible policy related to their continued mandates, but he repeatedly refused to share the government's plan to end the mandates, and I want to give him another chance right now. The provinces have shown leadership and are all moving on from COVID mandates. Will the minister tell Canadians on which date the Liberal NDP government will end the COVID mandates?
The Honourable Parliamentary Secretary.
Mr. Speaker, and I'd like to thank my colleague for his collaboration on the Health Committee. Today we know more about COVID-19 than ever before, and we're in a very different place than we were in March 2020. We have safe, effective vaccines and highly vaccinated population, as well as testing, surveillance tools, and new ways to identify variants of concern and track the spread of the virus. But the future remains certain, and COVID-19 is not over. There are many, many factors at play, and our government is committed to following the science going forward to get out of this pandemic for good.
The honourable member for Leeds, Grenville, Thousand Islands and Rideau Lakes.
And if the parliamentary secretary says the government is going to follow the science, then he should do that, just like the 10 chief medical officers of health have done in every single province in this country. They're all ending the mandate. So we want to know what the benchmarks are. What are the data points that this government is going to use to end the mandate? So they don't need to end the mandates today if they have a plan. But the problem is they don't have a plan. They're putting politics first. They're dividing Canadians, dividing communities. So when will they put politics aside, end the division, look to the science, follow the leadership of the provinces, their chief medical officers of health, and end the federal mandates?
The Honourable Parliamentary Secretary.
Thank you, Mr. Speaker. Thank my colleague across the way for acknowledging that my answer was both thorough and good. I also want to acknowledge that he asked some pretty good questions yesterday on committee, and I thought the answers that the minister gave him were excellent. This is a very complex issue. This is a very, very complex issue, and our government is going to keep making decisions based on the best science, and we also understand that there are two jurisdictions. There are provincial jurisdictions and there are federal ones. The provinces will make decisions accordingly with their health officials, and we will make our decisions based on the science, the exact same science, with our health officials. Thank you, Mr. Speaker.
The honourable member for Lethbridge.
Well, they might be based on political science, but certainly not medical science. Yesterday, when the health minister was asked to explain when federal mandates would be taken off, he shrugged his shoulders and he said, well, COVID is still here. No benchmarks have been set, no plan has been put in place, and no assurances have been given as to when we return to normal. This is absolutely irresponsible of the government. Provinces can do it, other countries can do it, why can't Canada do it? So when will the Prime Minister follow the science, the real science, lift the mandates, and give Canadians their freedom back?
The Honourable Parliamentary Secretary.
Thank you, Mr. Speaker. I'm happy to address the question from my colleague and the entire Conservative caucus that is unmasked today and is pretending that COVID-19 is completely over. I'm sorry, we can't wish the pandemic is over. We have to follow the science, and our government is committed to following that science.
I'm waiting for a certain level. I'm just waiting for a certain level, and we'll keep going. There, the Parliamentary Secretary.
Put your mask on. Thank you, Mr. Speaker. I will put my mask on as soon as I sit back down, like the rest of my colleagues who are committed to following the science. This pandemic is not over. Canadians...
Can we just wait until after question period is done? We can go out and run around or do something. All right. I am going to give the member an opportunity to respond. The Honourable Parliamentary Secretary.
Mr. Speaker, I want this pandemic to be over as soon as possible, just like every other member of this House. I've continued to follow the science, my colleagues have continued to follow the science, and we will ensure that we get through this pandemic. But the thing that I can't get over is the fact that Canadians are in the hospital right now. Over 5,000 Canadians are in the hospital right now with COVID-19, and you don't seem to care. Our colleagues across don't seem to care.
not done yet.